Welcome back to What's Now. Once again, all about your health. What is OAB? How can you avoid it? How can you treat it if you have it? Well, we'll let you know right now.
Patients with overactive bladder may have to rush to the restroom frequently because of a sudden and urgent need to go, and it may impact their daily activities. Here to talk about the condition, who it may affect, and what to do about it is urologic nurse practitioner Diane Newman from the University of Pennsylvania Penn Center for Continence and Pelvic Health Division of Urology. Diane, thanks for joining us.
Thank you for having me.
So why is overactive bladder a concern for people who have this condition?
Well, overactive bladder is very prevalent. Over 30 million Americans 40 and older have the condition. It's seen in both men and women, but primarily in women. And I'm here on behalf of Astellas to bring awareness to this really very prevalent condition of overactive bladder.
And Dr. Newman, what are some of the statistics surrounding the number of people who have OAB?
Well, it is over 30 million Americans, and what individuals will report, their symptoms include bladder urgency, that gotta go feeling. They will go to the bathroom frequently, like every time they see a bathroom sign they go, and it's usually more than 8 times during the day. And they may also have urinary incontinence, which is unwanted urine leakage. So you can see that this can be embarrassing. There's a stigma attached to it. And you know, the message is, if you have overactive bladder symptoms, please consult with your healthcare provider.
And what are some things you can do to treat this condition?
Well, there are some simple things, such as looking at your diet. We know there are certain things in foods and beverages that irritate the bladder. One is caffeine, which is, of course, in coffee, tea, chocolate, soda, and sometimes cutting back on ingestion of products that have caffeine will improve your symptoms. We also see it with tomato-based products and spicy foods. There's also strategies that control bladder urgency, that gotta go feeling. And there's also pelvic floor muscle exercises or Kegel exercises. We know that if you strengthen the pelvic floor muscle, you can prevent that unwanted urine leakage. So again, there's solutions if you have overactive bladder symptoms.
And are medications available as well?
Yes, there are medications available that help the bladder store urine. So that combined with other options really can improve your overactive bladder symptoms.
And what are your recommendations about talking with a healthcare provider and getting more help with this issue?
Well, I really always say that the informed patient is the better patient. So one really good resource is copingconfessions.com. So go there and learn more about overactive bladder. But also, a really good thing to do is keep a record, one-day record of your bladder habits. Write down every time you go to the bathroom, if you have bladder urgency, and also if you leak urine, and then write down what you're drinking, consuming. And then you take that record to your healthcare provider and show them and consult with them and say, look at what's happening here, can you help me? This is really adversely affecting my life. What can I do to help myself with these symptoms of overactive bladder?
And any other tips or information we need to know before we let you go?
Well, it's not normal. It's not a normal part of aging. You should not have to live with it. You should not hide it. Please talk with your healthcare provider. Learn more about overactive bladder. Go to copingconfessions.com, and really there are solutions for you.
Well, thank you so much, Dr. Diane Newman, for joining us today. Appreciate this great information about people who struggle with OAB.
Thank you very much for having me.
Thanks for watching this episode of What's Now, all about your health. Be sure to tune in to Park City Television all day, every day. You can head to our website, parkcity.tv, for more programming information. And also be sure to tune in live every morning for Mountain Connections. We'll see you next time. Thanks for watching.